Welcome to Real Hope, a monthly video series by the Mississippi Department of Mental Health to share more about specific services and supports that are available in our state to help our friends, family members, and neighbors who have a mental illness, substance use disorder, or intellectual or developmental disability. Each month in our Real Hope series, we will dive a little deeper into a specific service or support.
When we started doing this 30 years ago, as several of us that have been on this path a long time, we had very few services, only for children, adults, and that's pretty much it. Therapy, case management, and that's it. We have grown by leaps and bounds because we have A&D services, we have intensive community support services, we have intensive teams like PACT and I-Court, we have psychosocial rehabilitation services, we have a service for the bridge, homeless clients downtown. So we are meeting people. We're definitely in the community and we're meeting people where they are. We have a lot of services. We have limited resources, but we do a lot with a little.
PACT stands for Program of Assertive Community Treatment. We are here to meet the clients where they are, whether it's in their homes or somewhere in the community. And so with the team approach, we have the nurse practitioner, substance abuse specialist, peer support. These services are very important because this is the way that we keep the clients out in the community by providing them service to keep them stable so that they can have a successful life.
I-Court stands for Intensive Community Outreach Recovery Team. So we go out into the rural areas versus they go out into the city. If you can't get to the main office, we will come to you in the comfort of your own home. You would get your medications tended to. You would have a therapist come to you. You have a peer support, employment specialist. Well, our team consists of myself, a therapist. We have a peer support, and we have a nurse. It's easier for us to go out to them versus them coming into the office.
PACT and I-Court are intense services, and they're beneficial for people who have been in and out of the hospital and traditional treatment has not worked. Coming in the office has not been a good fit because of transportation barriers or whatever other taboo issues that are associated with the stigma associated with mental health. So therefore, taking the services to the client makes them comfortable. You're in your own home, we're meeting you where you are, and clients are oftentimes more receptive to services that way. And so in order to decrease hospitalization, we provide these services 5 to 7 times a week. So that means someone is going to come to see you, to meet you where you are, to help you connect you with resources in the community, to teach you healthy coping strategies, talk to you about medication adherence, connect you with employment if you're interested in working. So all of those services, we bring them to you. So it has been really successful because we find that there's a higher rate of clients staying engaged in services when you meet them where they are and you take the services to them in the community.
I'm Ashlyn Van Buren, and I'm ICSS, Intensive Community Support Specialist. I've always had a thing for wanting to help people, and I've always had a thing for mental health. So this came pretty easy for me, like knowing that I'm actually in the community and, as mentioned before, meeting others where they are and trying to actually be hands-on with them and, try to get them on a better streak or a more stable streak. I see my clients 2 to 3 times a week, and I deal with clients that have been in the hospital on multiple occasions. I try to make sure that my clients are housed, they get the proper service, they meet their goals. I work with them to make sure that they are more stable in the community and that they do pretty good out here.
I was really, really sick and didn't know it. And I wasn't functioning well, I wasn't taking care of my physical needs, I wasn't eating, and I was in a hallucinatory state, and I kept going to the hospital. I tried the traditional way, going to a doctor, but it didn't. I would still relapse. At first I didn't want to do it, but people encouraged me to join the PACT team. So I decided to do that. And it was, for me, it was the kindness and the love and the encouragement. And I found that a lot of hobbies that I like to do, since they encourage us to get out and socialize, I've been socializing more because I love company. So I love for them to come over. And just having someone to talk to sometimes about what I'm going through really helps me. Now I've taken a peer support class and got certified as a peer support specialist. And I'm also going to be taking piano lessons. So it's just encouraged me to do a lot of things that I wasn't doing at first.
I like the services because it gave me like a safe space to like be myself, to express myself, and like, to understand like everybody like go through something, and then they provide like other services as far as like activities, getting you out the house, doing different things like you normally probably just wouldn't do. It helped me a lot, and like it took me a long time to just come around and like open up and like, you know, challenge myself to become like a better person and to challenge my mental health, because there's something that I was not big on, or just realizing like in life, like, you know, like you're going through stuff and you like, is there any help out there?
It's different because when they come to your house, they get to see how you really are. And when you just go into the office, it's short and it's short-lived, and you really don't get to discuss the things as long, and for them to really understand what you're going through.
This is just a testament of how impactful the services are. When you meet clients where they are, this is what we did, and this is why we do what we do.
By making more people aware of the resources available in Mississippi, we can ensure that more stories of resiliency and recovery are created each day.